Welcome to our deep dive. Today, we're going to be exploring the World Health Statistics 2024 report. It's like getting a checkup for the whole planet,
Yeah.
covering like 2 decades of global health data.
Oh.
We're talking life expectancy, causes of death,
Yeah.
and whether we're on track to hit those big sustainable development goals.
Right.
And spoiler alert,
Oh,
things get kind of wild.
I bet. Well, it is fascinating how this report kind of reveals the impact of recent events, right?
Yeah.
Especially the COVID-19 pandemic.
Oh, yeah.
It's like you're reading a detective novel,
Okay.
but instead of clues leading to a culprit, we're uncovering trends and challenges
I like that.
that will shape global health for years to come.
Okay, so first up,
Yeah.
let's talk about the elephant in the room.
Okay.
Or maybe we should say the pandemic in the report.
Uh-huh.
Get this. COVID-19 wiped out over a decade of progress on life expectancy.
Wow.
It's like we were all on this upward escalator towards living longer, and then somebody just hit the emergency stop button,
Oh, no.
sent us tumbling back down.
Oh, wow.
Globally, both life expectancy and healthy life expectancy are back to where they were in 2012.
That's a big setback.
Yeah.
And it's not just about the tragic number of deaths directly caused by the virus.
Right.
The pandemic also kind of triggered a chain reaction of disruptions
Yeah.
to healthcare systems
Uh-huh.
worldwide.
Makes sense.
Imagine hospitals overflowing,
Oh, yeah.
routine checkups delayed,
Mhm.
essential treatments becoming harder to access.
Yeah.
All of these factors contributed to the decline in life expectancy.
Right.
It just paints a really stark picture of the pandemic's far-reaching consequences.
It really does.
Yeah. And here's where the story gets even more interesting.
Okay.
The impact wasn't evenly distributed.
Oh, really?
Some regions got hit way harder than others.
Oh, wow.
The Americas and Southeast Asia, for example,
Mm-hmm.
saw their life expectancy plummet by around 3 years. That's a staggering drop in just 2 years,
Yeah.
from 2019 to 2021.
Wow.
It makes you wonder why those regions were particularly vulnerable, right?
Yeah, definitely.
We'll give you some food for thought on that later. But think about it this way.
Okay.
Imagine a major event suddenly setting back healthcare in your country by a decade.
Whoa.
What would that mean for you?
Oh, gosh.
Your family,
Yeah.
your community?
Right.
Would it be harder to get the care you need?
Yeah.
Would you have to travel further?
Maybe.
These are some of the very real challenges people face during the pandemic.
Yeah.
And the report kind of helps us understand the magnitude of those disruptions.
Right.
All
I see. That makes sense.
right, so now let's shift gears a little bit
Okay.
and talk about those Sustainable Development Goals,
Okay.
or SDGs.
Right.
Remember those?
Okay.
They're like the UN's ambitious to-do list
Yep.
for a better world by 2030.
Mm.
And a lot of them focus on health, like reducing child mortality,
Yeah.
ending preventable diseases,
Mhm.
and ensuring access to quality health care for everyone.
Right.
Well, according to the report, we're not exactly acing this to-do list.
Oh, no.
Globally, we're off track to meet most of the health-related SDGs. And while the pandemic definitely threw a wrench in the works,
Uh-huh.
the issues run deeper.
Okay. Like what?
Here's a surprising example.
Okay.
Even before COVID-19 hit,
Okay.
progress on reducing maternal mortality and childhood deaths had stalled in some regions.
Oh, wow.
That's like hitting a roadblock on a journey that was supposed to be moving forward.
Right.
What caused this stall?
Yeah. What did...
Well, the report digs into that.
Oh,
And it's not a simple answer.
okay.
It's a complex web of factors,
Uh-huh.
from poverty and limited access to healthcare to deeply ingrained cultural norms.
Wow.
It's a reminder that there's no one-size-fits-all solution to global health challenges.
That's a good point.
But amidst all of this,
Yeah.
there is a glimmer of hope.
Oh, good.
The report shows that many health indicators are moving in the right direction globally.
Okay.
It's not all doom and gloom,
That's good to hear.
but the pace of progress has definitely slowed down.
Mm-hmm.
And there are still some pretty stark disparities between different regions and income groups.
Right.
It's like some parts of the world are speeding ahead in a fancy sports car,
Yeah.
while others are stuck in a traffic jam.
That's a good analogy.
We need to figure out how to get everyone moving forward at a faster pace.
Definitely.
Now for a head-scratching trend,
Right.
the double burden of malnutrition.
What's that?
Forget what you think, because it's not just about undernutrition anymore.
Okay.
We're seeing a rise in both underweight and obesity, often in the same population.
Oh, wow.
It's like the world is playing a strange game of nutritional seesaw.
Oh, I like that.
So
So give me some numbers.
The numbers are mind-blowing.
Okay.
Over 1 billion people aged 5 and up are obese.
Wow.
While over 500 million are underweight or thin.
That's a lot of people.
That's a massive double burden.
Yeah.
This points to larger issues like poverty,
Right.
unequal access to nutritious food,
Mm-hmm.
and even the way our food systems are set up.
Yeah, I can see that.
It's a reminder that individual choices are only part of the equation. The environment we live in plays a huge role in shaping our health.
I see. That makes sense.
So think of it this way.
Okay.
Imagine a family struggling to put food on the table.
Okay.
They might opt for cheaper, processed foods
Yeah.
that are high in calories,
Right.
but lack essential nutrients.
Mm-hmm.
This can lead to both obesity and undernutrition within the same household.
Wow.
It's a complex problem
Yeah.
that requires a multi-pronged approach.
Makes sense.
And speaking of complex problems,
Yeah.
let's talk about disability and health inequities.
Okay.
Did you know that people with disabilities often face a tougher road when it comes to their health?
Yeah, I can imagine.
It's a critical issue that often gets overlooked. The report shines a light on the fact that people with disabilities tend to die younger,
Mm-hmm.
experience poorer overall health,
Yeah.
and encounter more barriers to receiving care.
Wow.
And the reasons behind this are complex and multifaceted.
I bet.
The report lays out some pretty sobering findings.
Like what?
It's not just about physical obstacles like inaccessible healthcare facilities.
Right.
We're also talking about negative attitudes from healthcare workers
Oh, wow.
and a general lack of data on disability in many countries' health information systems.
Really?
It's like trying to navigate a maze in the dark. You're more likely to stumble and get lost.
That's a good way to put it.
Here's a powerful example from the report.
Okay.
A study found that women with disabilities are far less likely to receive breast or cervical cancer screenings.
Oh, that's scary.
This highlights the real-world impact of these inequities
Yeah.
and underscores the urgent need to address them.
Right.
We need to create a healthcare system that is truly inclusive and ensures that everyone has equal opportunities to stay healthy.
I agree.
Welcome back to our deep dive into the World Health Statistics 2024 report. We've explored some pretty heavy stuff so far.
Yeah.
Pandemic setbacks, the struggles with those SDGs,
Right.
and the inequities faced by people with disabilities.
Mm-hmm.
It can feel a bit like navigating a minefield
Yeah.
of global health challenges.
Definitely.
But the good news is
Oh.
the report isn't all doom and gloom.
Oh, good.
It also highlights some incredible success stories
Oh, that's nice.
and innovative approaches
Okay.
that are giving us hope for the future.
I like that.
It's like finding those hidden gems that remind us that progress is possible,
Yeah.
even amidst the complexity.
Right.
And some of these gems are truly inspiring.
Like what?
Take Bangladesh, for example.
Okay.
They've managed to eliminate not one,
Uh-huh.
but TWO major health threats.
Wow.
Kala Azar
Kala Azar.
and lymphatic filariasis.
Now, I know those names might sound like something out of a sci-fi movie,
Right.
but they're actually neglected tropical diseases
Yes,
that can have a devastating impact on people's lives.
absolutely.
Kala Azar, spread by sandflies,
Yeah,
can be fatal if left untreated.
that's right.
And lymphatic filariasis, also known as elephantiasis,
Yeah.
is caused by parasitic worms
Mm-hmm.
and can lead to severe disability and stigma.
It's really tough.
Oh, yeah.
Imagine living with the fear of a sandfly bite
Oh, God.
or the constant pain and social isolation
Yeah.
caused by elephantiasis.
That'd be awful.
Bangladesh's success in eliminating these diseases as public health problems
Right.
is a testament to the power of targeted interventions
Okay.
and strong public health systems. They
Right.
invested in research,
Mm.
developed new diagnostic tools
Okay.
and effective treatments,
Right.
and implemented vector control measures,
Like what?
like spraying insecticides indoors.
Oh.
But they didn't stop there.
So what else did they do?
They made sure these interventions reached everyone who needed them,
That's right.
leaving no one behind.
I like that.
It's like they launched a full-scale attack on these diseases,
Yeah.
using every weapon in their arsenal.
Nice.
And the results speak for themselves.
Right?
Bangladesh's victory offers valuable lessons
Uh-huh.
for other countries grappling with similar challenges.
Yeah.
It shows that with commitment, innovation,
Yeah.
and a focus on equity,
Right.
we can conquer even the most formidable foes
Yeah.
in the global health arena.
Yeah. Makes sense.
Mm.
So speaking of conquering foes,
Yes.
let's talk about another public health champion, vaccines.
Oh, yeah.
They're one of the most effective tools we have
Mhm.
to prevent disease and save lives.
Absolutely.
And the report highlights some exciting progress in this area,
Oh, good.
particularly in the fight against malaria.
Malaria, yeah.
Vaccines are like tiny superheroes
Right.
training our immune systems to fight off infections.
I like that analogy.
And we're seeing a new generation of vaccines emerging
Yeah.
that are targeting diseases
Uh-huh.
that have plagued humanity for centuries.
That's exciting. The report highlights the rollout of the RTS malaria vaccine, the world's first vaccine against malaria caused by the parasite Plasmodium falciparum.
So that's a big deal.
This is a huge deal,
Okay.
especially for Africa,
Right.
where malaria claims the lives of hundreds of thousands of children each year.
Yeah, it's really sad.
It's like finally having a shield
Yeah.
to protect the most vulnerable
Right.
against this deadly disease.
I agree. And what's even more encouraging
Yeah.
is that the report points to the success of the malaria vaccine implementation program,
Okay.
which is piloting the RTS vaccine in Ghana, Kenya, and Malawi.
Great.
Early results are promising,
Good.
and the vaccine is being seamlessly integrated into routine childhood immunization programs,
That's the best way to do it.
ensuring it reaches as many children as possible.
Exactly.
And here's the best part.
Okay, what's that?
The report highlights the high uptake of the vaccine without any unintended consequences.
That's what you want to hear.
People are embracing this new tool,
Yeah.
and it's not leading to a decrease in the use of other preventative measures,
Okay.
like insecticide-treated bed nets.
That's good.
It's a true testament to the power of collaboration and innovation.
It really is. But the fight against malaria doesn't stop there.
Okay, so what else is going on?
The report also mentions the WHO's recent recommendation for the routine use of the R21 malaria vaccine.
Oh, cool.
This is the second effective malaria vaccine
Okay,
to receive the green light.
so it must be pretty effective.
And it has the potential to be a game changer in our efforts to eradicate this devastating disease.
Wow, it's like having a 1-2 punch against malaria,
That's a good way to put it.
giving us hope for a future where this disease is no longer a threat.
That's the goal. Now let's shift gears and talk about a threat that's often lurking in the shadows.
Okay.
Antimicrobial resistance.
What's that?
You know those superbugs
Oh, yeah?
that are becoming resistant to our antibiotics?
Right.
It's a silent pandemic in the making.
Uh-oh.
And if we don't get a handle on it,
Yeah.
we risk returning to a time
Okay.
when simple infections could once again turn deadly.
Oh, wow. It's like we're in an arms race with bacteria and
Yeah.
they're starting to win.
That's a scary thought.
Yeah, it is.
So the report stresses the importance of global collaboration and coordinated action to tackle this challenge.
Let's see.
The WHO's Global Action Plan on Antimicrobial Resistance provides a framework for countries
Okay.
to develop and implement national action plans that promote responsible use of antibiotics,
Makes sense.
strengthen infection prevention and control measures,
Uh-huh.
and invest in research and development of new antibiotics.
Okay.
It's a multi-pronged approach
Right.
that requires commitment from governments,
Yeah.
healthcare providers, and individuals alike. We all have a role to play in preserving the effectiveness of these life-saving drugs.
I agree. So are there any positive trends?
The report does highlight some positive trends.
Okay. Like what?
For example,
Yeah.
there's been a decrease in the global consumption of antibiotics
Okay.
for animal production.
Oh, interesting.
That's a crucial step in the right direction.
Right.
As overuse of antibiotics in animals
Yeah.
is
yeah.
a major driver of antimicrobial resistance.
That makes sense.
It's a reminder that our actions have consequences, and we need to work together
Right.
to protect these precious resources for future generations.
Makes sense.
Yeah.
Speaking of essential resources,
Yes.
the report also shines a light on the importance of water, sanitation, and hygiene.
Right.
Those basic things we often take for granted.
Yeah.
But access to clean water and sanitation is not a luxury.
No, it's not.
It's a fundamental human right
Absolutely.
and a key ingredient for good health.
You wouldn't believe how many health problems are linked to unsafe water.
I bet a lot.
Sanitation and hygiene.
Yeah.
We're talking diarrheal diseases,
Right?
respiratory infections, undernutrition, even death.
Wow.
It's a stark reminder that something as simple as washing our hands can make a world of difference.
It really can. So have we seen any progress in this area?
The good news is
Okay.
we've seen some progress in this area.
Oh, good.
The global coverage of safely managed drinking water
Oh,
and sanitation has increased in recent years,
right.
but there are still vast disparities between regions.
Really?
With the African region lagging behind.
Oh, that's unfortunate.
It's a call to action.
Okay.
To prioritize investments in water and sanitation infrastructure.
Right.
Especially in low-income countries where the need is greatest.
I see. That makes sense.
Imagine a world where everyone has access to clean water.
Yeah.
And a safe place to go to the bathroom.
Right.
It sounds basic.
Yeah.
But it would have a profound impact on global health.
Yeah, I think so too.
We need to keep pushing for progress in this area and ensure that everyone has the opportunity to live a healthy and dignified life.
Definitely.
No.
Now let's talk about a topic that's often surrounded by controversy.
Okay.
Alcohol consumption.
Oh, yeah.
It's a complex issue, deeply ingrained in many cultures.
It is.
And it's not always easy to talk about.
That's true.
So what does the report say?
The report doesn't shy away from this sensitive topic.
Okay.
It emphasizes the need for evidence-based policies and interventions to reduce the harmful use of alcohol.
Okay.
It highlights the WHO's Global Alcohol Action Plan,
Right.
which provides a roadmap for countries to implement proven strategies.
Like what?
Like taxation, restrictions on alcohol sales and marketing, and support for people with alcohol use disorders.
Right.
It's about finding a balance between individual choices and protecting public health.
Makes sense.
We need to have honest conversations about the risks associated with alcohol consumption. Right.
And create environments that support healthy choices.
I agree. So, are there any encouraging trends?
The report does offer some encouraging trends.
Oh, good.
For instance, there's been a decrease in the global per capita consumption of alcohol in recent years.
Oh, okay. That's good.
However, it also acknowledges that alcohol consumption is on the rise in some regions.
Really? Where?
Particularly in low and middle income countries.
Oh, wow.
This highlights the need for targeted interventions that take into account the specific cultural and social contexts of each region. There's no one-size-fits-all solution.
Right.
We need to understand the unique challenges and tailor our approach accordingly.
Okay, that makes sense. Speaking of tailored approaches, let's talk about the importance of strong primary healthcare systems.
Oh, absolutely.
It's like the foundation of a house. Without a solid base.
Right.
Everything else crumbles.
Exactly.
So what exactly is primary healthcare? Primary healthcare is about providing essential healthcare services that are accessible and affordable to everyone.
Right.
Regardless of their income or social status. It's the first point of contact for most people when they need medical care.
Yeah.
And it plays a vital role in preventing illness, promoting health, and managing chronic conditions.
Right.
Think of it as the front line of defense against disease and a gateway to a healthier life.
Like that.
The report emphasizes that investing in primary health care is not just the right thing to do. It's also the smart thing to do.
I agree.
It's about empowering individuals and communities to take control of their health and well-being.
I see.
And it pays dividends in the long run, both in terms of improved health outcomes and reduced healthcare costs.
That makes sense.
The report highlights the importance of ensuring that everyone has access to a trained and motivated health workforce, especially in rural and underserved areas. Right. It also stresses the need for strong health information systems that can track progress, identify gaps, and inform policy decisions. And of course, we can't forget about adequate financing for primary health care. It's an investment that pays off in countless ways: healthier individuals, stronger communities, and a more equitable world.
I agree.
But it's not just about throwing money at the problem. It's about using those resources wisely and strategically to create sustainable and resilient healthcare systems that can withstand shocks.
Like what?
Like pandemics.
Oh, yeah.
And climate change.
That's a good point.
Yeah.
Now, remember those ambitious triple billion targets?
Yes.
Set by the WHO?
I do.
They aim to achieve some pretty remarkable feats by 2025. 1 billion more people with universal health care coverage. 1 billion more people better protected from health emergencies. And 1 billion more people enjoying better health and well-being.
Those are ambitious.
It was like setting our sights on the moon and aiming for a giant leap forward in global health.
I like that. So did we achieve those targets?
While the report acknowledges that we're not quite on track to achieve these targets by the original deadline, it highlights The significant progress that has been made since 2018.
That's good to hear.
Millions more people now have access to essential healthcare services.
Right.
And there's been a notable improvement in emergency preparedness.
That's encouraging.
But we can't afford to rest on our laurels.
No, we can't.
Achieving these ambitious goals requires a renewed commitment to building resilient and equitable health systems that leave no one behind.
Absolutely. It's about addressing those underlying social and economic factors that drive health inequities and working together across sectors and borders to create a healthier world for everyone.
I agree.
It's about empowering individuals and communities to be active participants in their own health and well-being.
That makes sense. So let's zoom in on some of the specifics. On the progress made towards universal health coverage.
Right.
The UHC billion.
Yeah.
One of the bright spots highlighted in the report is the significant progress in HIV treatment.
HIV treatment, okay.
More people living with HIV are receiving life-saving treatment.
It's great to hear.
Especially in the Americas, Europe, the Western Pacific, and the Eastern Mediterranean regions.
Wow.
It's a testament to the power of scientific advancements, global collaboration, and unwavering advocacy.
I agree. However, the report also acknowledges the uneven distribution of this progress, with Africa and Southeast Asia lagging behind. It's a reminder that we need to double down on our efforts to address those underlying inequalities and ensure that everyone has access to the health care they need, regardless of where they live or their socioeconomic status.
I agree. The report also sheds light on a major obstacle to achieving universal health coverage. Catastrophic health spend.
What's that?
We're talking about situations where people are forced to choose between health care and other essential needs.
Oh my gosh.
Like food and shelter.
That's awful.
It's a heartbreaking reality for far too many people around the world.
Yeah.
And it hits hardest in the Western Pacific and European regions.
Wow. The report stresses the need for stronger social protection mechanisms and more equitable health financing systems. It's about ensuring that healthcare is affordable for everyone, not just the privileged few.
Definitely.
It's about moving towards a world
Yeah.
where no one has to face financial ruin because of illness.
I like that.
Yeah.
Now let's turn our attention to the Health Emergencies Protection Billion.
Okay.
Despite facing setbacks during the pandemic, progress has continued.
Okay.
Though not at the pace we had hoped for.
Right.
The report indicates that achieving this target requires substantial acceleration in strengthening emergency preparedness, prevention, detection, and response systems.
I see.
We need to invest in early warning systems, build capacity for rapid response, and strengthen global health security.
I agree.
We need to be proactive, not reactive.
The report emphasizes the need for greater collaboration and coordination between countries, as well as between different sectors, like health, agriculture, and environmental protection. It's a reminder that we're all interconnected, and we need to work together to build a world that's better prepared to face future health threats.
That's a good point.
So let's shift our focus now to the Healthier Populations Billion.
What's that about?
This target is all about improving overall health and well-being using a range of indicators.
Like what?
Like life expectancy, maternal and child mortality rates, and prevalence of non-communicable diseases. The report reveals encouraging progress. Particularly in Southeast Asia and the Western Pacific regions. But there are still persistent challenges.
Really? Like what?
Posed by issues like malnutrition, air pollution, and lack of access to quality health care.
Makes sense.
It's a reminder that achieving this target requires a holistic approach that addresses those underlying social, economic, and environmental determinants of health. It's about creating an environment where everyone has the opportunity to live a long, healthy, and fulfilling life.
I like it.
And it's about ensuring that no one is left behind in the pursuit of global health and well-being.
I agree. Stay tuned for part 3.
All right.
Where we'll delve deeper into what all of this means for you, the listener.
Sounds good.
And how we can all play a part in shaping a healthier future. Welcome back to the final part of our deep dive into the World Health Statistics 2024 report. We've journeyed through the highs and lows of global health, uncovering challenges,
Yeah.
celebrating successes,
Mm-hmm.
and exploring innovative solutions.
That's right.
But you might be wondering,
Yeah.
what does all of this mean for me?
Well, that's the million-dollar question, isn't it?
It is, right.
Yeah.
We've thrown a lot of data at you,
We have.
from pandemic setbacks
Right.
and those ambitious SDGs
Mm-hmm.
to the double burden of malnutrition
Mm-hmm.
and the inequities faced by people with disabilities, refugees, and migrants.
It's a lot.
It's a lot to process.
Yeah.
But remember,
Yeah.
the goal of these deep dives isn't to overwhelm you with facts and figures.
Right.
It's to empower you with knowledge
Yeah.
and inspire you to think differently about global health.
Think of this report and our deep dive as a starting point.
Okay.
It's like we've given you a map and a compass
Mhm.
to explore the vast and complex landscape of global health.
Okay.
Now it's up to you to chart your own course
Right.
and discover what resonates with you.
These global trends, while seemingly distant, have ripple effects that touch all of our lives.
They do.
The pandemic proved that in a dramatic way.
Absolutely. We saw how interconnected our world truly is.
Yeah.
A virus in one corner of the planet can quickly become everyone's problem.
It's true.
And that interconnectedness extends to many of the issues we've discussed.
Like what?
Progress on those SDGs, for example,
That...
isn't just about improving lives in far-off countries.
Right.
It's about creating a more stable, just, and prosperous world for everyone.
Think about it this way.
Okay?
When we invest in global health,
Yeah.
we're not just helping others.
Right.
We're also investing in our own future.
I like that.
A healthier world is a safer world,
Uh-huh.
a more equitable world,
Yeah.
and ultimately a better world for all of us.
Makes sense.
Now, speaking of investing in a healthier future,
Yeah.
remember how we talked about the importance of strong health information systems?
I do.
The report actually highlighted a really cool tool
Oh, yeah.
developed by the WHO, the SCORE for Health Data Technical Package.
What's that?
It's like a toolkit for countries to strengthen their health data systems.
Oh, cool.
It's all about empowering countries to collect accurate and reliable health data,
Yeah.
which is essential for making informed decisions about policies and interventions.
Right.
It's like giving countries the ability to tell their own health stories
Mm-hmm.
with clarity and precision.
I see.
And those stories matter.
They do.
They help us understand the unique challenges and opportunities faced by different populations.
Yeah.
And they guide us in finding solutions that are tailored and impactful.
So what does this all mean for the listener?
It means you have a role to play in shaping a healthier future.
Everyone does.
It means being informed,
Mhm.
being engaged,
Yeah.
and being an advocate for change.
How can listeners do that?
Read the full World Health Statistics 2024 report.
Okay.
It's free and available online.
Cool.
Talk to your friends and family about these issues. Support organizations that are working to improve global health.
Makes sense.
Even small actions can make a difference.
Absolutely.
Volunteer your time.
Hmm?
Donate to a cause you care about.
Yeah.
Or simply spread the word.
Right.
Because at the end of the day,
Yeah.
a healthier world starts with each of us.
It does.
We all have a part to play in creating a future
Mm-hmm.
where everyone has the opportunity to thrive.
So until next time,
Yeah.
stay curious, stay informed, and stay engaged.
Great advice.
The journey towards a healthier world continues.
It does.
And we're all in this together.